What's up? Dr. Roland here from the Sky Clinic, and as you know, WHO already has released a statement that the COVID-19 is a global pandemic. That means it's already spread across the whole planet. What we need to do is, the first thing is, I tell you, please be calm. Do not be historical. Do not be jumping around needing to run to supermarkets, get this, get that. Already we have shortage of supply of masks, gloves in the market. Even for us, we already have to use our reserve stocks at the moment. So public, again, do not need to wear mask if you do not have any symptoms of cough, flu, fever, etc. Please do not use the mask, because some of you use the mask and then put it into your bag, touching and having contact with the external component of the mask, so you will already get contaminated if you actually come across. So no point of doing that. And some, I even see them folding the mask and putting that back in the pocket and then keep reusing again. So you only need to use those kind of personal protective equipments if you are having those symptoms. So please be calm. Second thing, do not go and ambush clinics or government or even private hospitals. If you have symptoms, then go. Don't put fear into yourself just for the sake of screening. You might get turned down from all the centers if you do not have symptoms. They might tell you to just go back if you do not have symptoms, and they will not proceed to do any screenings of COVID-19 because of the limited stocks of equipment, products and stuff. Even for us as part of the house call team, if the patient doesn't have any symptoms, we would turn down the procedure. This is because we all have limited kits, equipment and also resources. So public, please understand that. Second thing is, practice self-quarantine. If you already have cough, fever, flu and also some signs of chest discomfort, then yes, please go and get some advice from a hospital or stuff. And if you think the symptoms are pretty decent and minor, it's just maybe you're just having a slight amount of fever and flu and cough, please stay at home and practice self-quarantine, because we do not want to spread the disease exponentially. There are reasons why you don't want to spread the disease exponentially. Clearly because we have limited resources. So if we spread the disease exponentially, what's happening? We will actually block and clog all the hospital systems, all the government settings, then tak ada bilik. There would not be enough of rooms to manage. So self-control, self-containing has been proven significantly effective at this position. Why we need to delay this? Sorry, I got a phone call. So the third thing we need to look at is resources. So when it comes to resources, one thing we need to make note is food supplies, equipment supplies. I know there's a lot of countries already imposing landlocks. That means no flying in, no flying out. So you will have a disturbance in terms of supply and systems. So do not go and crash supermarkets. Do not go and just grab everything that is available on retail, because you will disrupt the supply again. So keeping the condition calm is very, very crucial at the moment. And the last, traveling. Of course, there are traveling imposes already been mentioned and said to certain countries where there are high risk, for example like Italy, Japan, Korea. So these are the things, these are the areas that you want to avoid.
1 minute 37 seconds later.
Okay, next up, number 4 is events. So many big international events are now put to question whether they will proceed. So currently, if you have any big events more than 50, 100, 200 people, you might want to avoid these things, because the high risk of contact and exposure towards the virus could be very high. Okay, and then the last but not least, the most important one, which is going to be hygiene. So make sure you practice proper hand sanitization. use your alcohol swabs, clean up, make sure your hands are clean, having contacts. If you don't want to shake hands and stuff like that, I think it's pretty fine. You can avoid those kind of things. You can do your namaste like that if you want to. Avoid as much contacts if you can. Okay, so that's about it. Please be calm. If you need any help from the KLCC clinic, if you're not too sure, if you think that you are a suspect, you need certain medical attention, please get some medical advice from us. Just contact us, call us. We will actually help you get the right information. If you need screening, if you are a suspect that needs screening, you can call our house call system. We have the rapid test available. We come in to your home, get the test done. If it's negative, fantastic. If it's positive, then we need to send you out to get yourself further assessed in a private or government hospital. So that's about for me, Dr. Roland here. You take care, stay safe, stay calm.